Hello and welcome to StudyIQ. In this lecture, we will discuss about the National Health Protection Scheme or the NHPS. So this scheme is also known as Ayushman Bharat Scheme. So other name of the scheme is Ayushman Bharat Scheme, and this is also known as the Modicare. Why? Because in US it was known as Obamacare, and in India it is dubbed by the name Modicare. So the scheme is known by other names also. That is the National Health Protection Scheme. The other names are Ayushman Bharat Scheme or it is also commonly known as Modicare. Let us see what is this National Health Protection Scheme or what is NHPS. So the National Health Protection Scheme aims to provide health insurance. So first thing you must understand is this scheme is with regard to health insurance. So it aims to provide a health insurance of rupees 5 lakh to 10 crore poor people. So the target is 5 lakh rupees to 10 crore poor people. So the number of beneficiaries are 10 crore and the amount is 5 lakh per person. And the amount is 5 lakh. So this 5 lakh rupees will be provided to 10 crore poor people and vulnerable households. So under this scheme, this 5 lakh rupees insurance amount, this 5 lakh will be provided to each family per year. So this 5 lakh is for a family, not per individual. This is per family per year in secondary and tertiary institutions. So 5 lakh rupees per family per year in secondary and tertiary institutions. Therefore, the NHPS or the National Health Protection Scheme will have 50 crore beneficiaries. So 5 lakh per family per year. So why is NHPS important? One thing you must remember about NHPS is that it is the world's largest government funded healthcare program. So this is the world's largest. Why? Because it is because of the population in India. We know India have a huge population, and providing insurance to such a huge population will require huge funds. Therefore, it is the world's largest government funded healthcare program. And the aim of this program is to provide quality healthcare to citizens. So we said that this is the world's largest healthcare program. So if we have to look at the statistics, this scheme or health protection scheme covers more people or more population than US, UK and Germany combined because of huge population in India. So if we take these three countries' population together, the scheme provides for more beneficiaries. So that is because of the population in India. One more thing about this scheme is this is massive and near universal. So near universal means almost everyone will get benefit out of it. So this is near universal, and also this is a massive health protection scheme. So one thing you must remember here is that after 1980s, welfare measures under the health sector has come down. Why? Because of the fiscal constraints of the government. So because of the fiscal constraints of the government, since 1980s, the welfare measures in health sector has come down, and this is going to be a very big initiative in the health sector of the country. And coming to the funding of this scheme. So fund of National Health Protection Scheme. 40% of the fund has to come from the state. So we have, in a previous module, we have seen about central sector schemes, centrally sponsored schemes, and also core of the core schemes. So can you tell me under which would this health protection scheme will come? This will come under centrally sponsored schemes, which means under the centrally sponsored scheme, financial assistance is given to the center to the state. The center does not 100% fund such projects. So such schemes are not 100% funded by the center. So here also you will see that this is a centrally sponsored scheme where 60% of the total fund or the total amount involved in the scheme is given by the center, and 40% of the fund has to be collected from the states. And why is the need for NHPS in the country? National Health Protection Scheme is very much needed in the country. Why? Let us see the reasons. So first reason is that out-of-pocket expenditure in healthcare. So if we look at the out-of-pocket expenditure on healthcare, it is nearly 63% of the country's total health expenditure, and this is a very huge amount. And if we compare the 63% with other countries in the world, this is one of the highest in the world. 63% in India, it is one of the highest in the world. And if we look at other counterparts, for example, the out-of-pocket expenditure on healthcare is 32% in China. In US, it is 11%. And if we take the world average, it is 18.2%. So just see, the world average is 18.2% and India it is 63%. So the margin or the gap is very huge, and that is one reason the government is planning for a national health protection scheme. So such a huge out-of-pocket expenditure on healthcare is unaffordable for the poor in the country. So this is unaffordable for the poor, and also every year if we see, many of the people become poor, or they come under the poverty line, they become below poverty line, or they are included in the BPL just because of their expenses on health. So the health expenditures or huge expenses on the health sector in our country can lead or is already leading millions of people into poverty every year. So it is high time that government makes a plan in order to accommodate the needs of the poor and vulnerable in the healthcare sector and provide them with adequate healthcare facilities at affordable cost. So one thing we must remember here is that India as a country, there is under-investment in health sector. So under-investment means there is no enough investment, or what is the required investment, or what is the demand, the country is investing less than that. So there is under-investment in health sector in India. So because of this underinvestment, it has badly affected the health and financial well-being of its citizens. So we have seen how it has affected the quality healthcare is not assured to poor and vulnerable because it is very costly, and we have also seen that because of huge out-of-pocket expenditure on health, it affects the financial stability of the citizens also. It doesn't mean that all the insurance programs in the country have become successful. But if implemented well, insurance schemes in the country can save not only the life but also financial well-being of citizens. Now let us have a look at the current public health infrastructure. So public health infrastructure and what is the situation at present. According to government's Rural Health Statistics 2017, it is in the year 2017, India had merely 1,800 proper functional hospitals in rural areas. So proper functional hospitals in rural areas is merely 1,800. And according to this report, it says that there is a shortfall of 19% of sub-centers, 22% of PHC or primary health centers, and also 30% in terms of community health centers. So there is a shortfall, 19% of shortfall in sub-centers, 22% in PHC or public health center, and 30% in community health centers. And the number of buildings that are required to meet the current demand in the healthcare sector, that is 40,000. So 40,000 buildings are required as of March 2017. So 40,000 buildings were required to meet the demands in the healthcare sector. And even if this 40,000 buildings existed, they are merely shells because there is no adequate staff. So there is a problem not only with infrastructure but also with manpower or staff. So two major problems are infrastructure and second one is staffing or proper manpower in the healthcare sector. Again, coming to other issues, a quarter of the public health centers, that is the PHCs, about 1/4 of the PHCs does not have adequate electric power supply and also water supply. So power and water are also in short in the public health centers. Another major problem in the government health centers is that the equipments which are already purchased, they are not being used, and this is according to the CAG's report. CAG is the Controller and Auditor General of India. So the CAG report says that there are instances where high cost equipments are purchased in the government hospitals, but they are not used or they are not made into utilization. And the CAG report also says that there is a shortage of equipments in the hospitals. So there is shortage, and also along with the shortage, whatever is already purchased, they are not being used also. Again, coming to medical personnel or manpower, if we take the cases of well-performing states like the Kerala or the Tamil Nadu, there are still vacancies in these states also. In Kerala, there is around 5.9% doctor vacancies in public health centers, and in Tamil Nadu, there are around 7.6 doctor vacancies in public health centers. So, this is the case with the best performing states or the topmost states in health sector. And what will be the situation of other states who are performing worse in the healthcare sector? If we take the example of West Bengal, if we consider the states like West Bengal, Jharkhand, Chhattisgarh, etc., there are almost 40% vacancies of doctors or medical staff in the health centers. And coming to Bihar, there is around 63.6% vacancies in public health centers. So this is with regard to the doctors. And if we take the nursing staff or staff nurse, states like Rajasthan, Haryana, Bihar, etc., they have around 50% of vacancies in nursing staff, and Jharkhand has 75% of vacancies in nursing staff. So it is very clear that there is a shortage of manpower or medical staff in the public health centers, and that is also a very big issue. And according to a World Health Organization report, the WHO report says that only one out of 5 doctors practicing in the rural areas are qualified. So underqualification or not having proper qualification is also a very big issue in the healthcare sector. And the same WHO report says that around 31.4% of doctors or people who call themselves as allopathic doctors, they are only educated till 12th standard in the rural areas. So this is the situation with the medical staff or doctors in India. So all these issues, one is infrastructure, second one is not properly utilizing or utilization of already existing equipments or infrastructure. Again, understaffing, qualification of the doctors, increased out-of-pocket expenditure. All these reasons have culminated into the formation of National Health Protection Scheme. So, National Health Protection Scheme is a necessity for the country considering all these factors. So we said that NHPS or the National Health Protection Scheme is the necessity of the hour or need of the hour. But what are the flaws in it or what are the shortcomings in the scheme? Let us analyze. The aim of any insurance policy should be to improve the Medicare for the masses. So Medicare for masses should be improved, and especially when the policy or the insurance scheme comes from the part of the government, the aim should be to improve the Medicare for masses. So there is a difference between medical insurance. So there is a difference between medical insurance and also actual healthcare services. So medical insurance is just a financial product, which means you are providing some insurance or you are giving financial support. It is a financial product. And what about actual healthcare? This is a reality. This is far more than providing financial support. The second one, that is providing actual healthcare. It includes the creation of healthcare infrastructure, staffing, or equipping the hospitals with qualified and enough number of staffs. It can be doctors, staff nurses, or medical personnel. So here the major challenge is to create physical infrastructure. So physical infrastructure like buildings or infrastructural facilities, machineries, equipments, etc. to the hospitals, and also equip the hospitals with enough staff. So these two are the major challenge, and the NHPS doesn't seem to address these important challenges. NHPS, or the National Health Protection Scheme, is aimed at providing medical insurance or financial assistance to poor and vulnerable categories, but it does not address two major challenges in the healthcare sector. That is, one is physical infrastructure and the second one is inadequate staff or staffs who are not qualified. So we said in the beginning that NHPS targets to cover 50 crore poor and vulnerable or 10 crore families. So according to this scheme, it is going to provide potential consumers for the private hospitals. So they will be getting 5 lakh rupees per family per year insurance cover. So these people would be approaching the private hospitals. So the private hospitals will have more customers. So in the National Health Protection Scheme, the government does not properly mention the government's role in it. So when you are giving some products to the private, the aim of the private sector will always be to make maximum profit or get maximum profit out of it. So profit maximization is the aim of the private, and government is providing merely insurance. So the government should also have some direct role or direct involvement in order to oversee the role of the private sector in providing the healthcare facilities to the poor and vulnerable of the society.